Hello, my name is Taylor Franklin. This is for Psych 301. This is video 1 for our first debate. Me and my partner decided on the topic of assisted suicide with more of a focus on those who are terminally ill, and my position is against it. So first I want to describe what assisted suicide is, and the definition is a suicide of a patient suffering from an incurable disease or they are terminally ill, and it's affected by the taking of lethal drugs provided by a doctor or physician for this purpose. So some facts about it are it is legal in 9 states and Washington, D.C. So over on the map on the side you can see which ones they are. Some qualifications are individuals must have a terminal illness and they must have a diagnosis of 6 months or less to live. So for assisted suicide, physicians are not able to be prosecuted. It is solely the patient's decision to have this done. So it can't go back legally to being the physician's fault. Also, there are different ways to do it. There are drugs, there are injections, or sleeping pills, but it has to be from a physician and it has to be done in the state in which the patient is a resident. So topics I'll be discussed in this are the effects of assisted suicide in every aspect, the ethics of physicians, so whether it's morally correct, ethically correct, and also the drive behind the decision. So what goes through the patient's head when deciding if assisted suicide is right for them. So, like I said earlier, I'm against assisted suicide for those who are terminally ill, and one reason is it actually does more harm than good. So, like any loss of a loved one, it's very emotional. It can affect family members, and it is just a very, very sad time, no matter who dies. But knowing assisted suicide is different because knowing that it was a choice can be very detrimental to live with. So, because they decided that their life was worthless and that there was no choice, no reason to live anymore. So that could be really effective. It can be really hard on families to comprehend that. It also can cause underlying pressure. So if someone chooses assisted suicide, there can be pressure to others in a similar condition to do it too, or to see their life as not worth living as well. It kind of creates a pressure, and yeah. Also, reason number 2 is it is against what physicians stand for. So, by bringing up the option to a patient, it gives the state of approval from the physician. So, by even bringing it up, and physicians are supposed to help heal a patient and help promote health and in every aspect. So, whether that's mental or physical, and that goes against what physicians are for. By offering assisted suicide, they're kind of just giving them an out. So they are not promoting mental and physical health when they do that. Number 3 are some patients do it for the wrong reasons. So from the research that I've conducted, more cases than not have to do with mental health rather than the pain tolerance. And I'm not discounting those who have a terminal illness that are in pain. That's a whole different aspect of it, but I have found that the underlying reason of considering assisted suicide is just from the loneliness and the anxiety and the depression that it causes. And they don't want to feel like a burden to their families, and they feel like they've lost their dignity. And these attitudes they're not worth losing a life over. And although it's hard to deal with those things, there is mental health advocates and mental health doctors that can that can help and help them see that life is worth living and there's joys every day. Reason number 4 is it just simply devalues human life. It just shows that life isn't worth living anymore, just because I have this illness. And an example of that is a testimony I found from a woman named Jeanette Hall. Jeanette was diagnosed with colon cancer, and it's a terminal illness, so she is never going to recover from it. And in her life, her brother actually died of suicide, and her mom died with dementia. So she saw she had effects from her brother's decision of suicide, and she saw how her mom carried out with her illness, and it caused her a lot of pain. And so when she was diagnosed with colon cancer, she just flat out told her physician that she wanted assisted suicide because she just didn't want to deal with it. But her physician asked her to think about it. So he did not directly say yes. He asked her to think about the weight of the decision from every angle possible. And her physician asked her questions about her family, like, are you sure you want to miss your son's graduation of the police force? Are you sure you want to miss out on him getting married someday or having kids someday? You're going to miss out on that. And that really challenged her thinking, and she was able to, it gave her some hope, like, yeah, I do want to see that. And you're right, I would miss little things. And also, she did not want her son to have to go through the pain that her brother did to her. So she did not want her son to have to live with the feeling of why did she do that, or is it my fault, or any of those thoughts at all. So she decided that life was actually worth living. Um, and the physician here challenged her thought, and he promoted health by not directly saying yes, because he could have just said, yes, all right, let's do assisted suicide. But no, he wanted to ask her hard questions, and he didn't want the family to have to go through all that pain again. So the influence of the context and assumptions are, I have no experience with assisted suicide. There's nobody in my family that's went through it. I don't know anybody in my life that has been affected that I know of. The only experience I have is from movies like Me Before You, and it's just really hard to comprehend. I also am a Christian. I go to church, so I am very much pro-life, and I think ending life is never the answer. So I do have those biases. Um, but yeah, so this is my debate, and thank you for listening.